We are rolling.
Okay, y'all got your workbooks? You need your workbooks?
Almost.
So we're going to talk about two concepts today. We're going to talk about waves, segments, intervals, and then I'm going to cover some information about artifact. Okay, it's a lot, but we're going to get through it, and we can take a break midway if we need to. All right, so your notes initially are going to be on page 49 to 51. That's over our wave segments interval, and then we'll switch gears to artifact, which will be on page 60. And then I have some practice pages for you guys that I'd like for you to finish while you're with me today, if you can, 52 to 55. All right? Okay, let's get into this. Wave segments intervals. Okay. First thing I want to do is review amplitude and duration real quick before we get into talking about our concept. All right, so when I hear the word amplitude, I'm thinking about what axis? Y or vertical, right? Okay, this guy right here. What are some other words for amplitude?
Sensitivity.
Or sensitivity, right? All the same thing there. Did I spell that right? Nope.
Nope.
Sensitivity.
Another I. It's okay, we get it.
You get the point. Okay, so we're talking vertical axis or our y-axis. Give me the value of one tiny box.
1 millivolt.
0.1 millivolt. Yeah, but wait, we're not there yet. We're just talking amplitude, but good job. Okay, give me the value of one large box on this amplitude. 0.5 millivolts. Very good. Okay, let's talk duration now. What's another word that I might see instead of duration? Maybe time? It's good. What axis am I concerned with if we're talking about duration? X or horizontal axis, right? Okay, very good.
Hot dog.
Give me the value.
That's how you fold a piece of paper.
Give me the value of one tiny box.
Hamburger.
0.04. What's my unit? Seconds. Seconds, right? Seconds. Very good. Okay, hey, what's the value of one large box? Give me that value.
0.2.
0.2.
Seconds.
Right? Seconds. Very good. 0.2 seconds. Okay, how about this right here?
No, 1
No,
second.
1
I've got 1, 2, 3, 4, 5 large boxes equals 1 second. Very good. 30 large boxes
It's 6 seconds.
equals 6 seconds. Very good. Okay. Are we feeling okay? A little bit tapped into our amplitude and duration as we get into today's lesson. Okay. So let us get to page 50. Okay, so page 50, we're going to start talking about our waves and breaking down some good information here. So when I'm looking at an EKG and I see a P wave, I want it to be smooth. I want it to be positively deflected. Nice, smooth, round shape there. A normal duration for a P wave is 0.12 seconds or less. Okay? So duration, 0.12 seconds or less. All right, amplitude. This is the only wave that I'm going to give you a normal amplitude for. Okay? 0.25 millivolts or less. Okay, on your amplitude there for a P wave. And what are we measuring in the P wave? We're measuring the depolarization of the atria. Okay? If I say the word depolarization, what else are you thinking or visualizing in the heart? Contraction. Very good. So depolarization, contraction. That's good. All right. Let's let's label it on page 49. All ready? Right there. You don't have to write the word wave. You can just put the P. But there's our P wave, our cute little P wave right there. What are we measuring? The P wave? The depolarization of the atria. Very good. Okay, let's keep rolling. Let's talk about the QRS. So what's the shape of my QRS? So let's talk about the R first. The R is going to be positively deflected, super sharp in its shape, and that R is going to dominate the complex. Okay, you'll see that there. The Q and the S are typically negatively deflected, so they go below the isoelectric line, also sharp in their shape or presentation. The duration, the normal duration of a QRS is 0.12 seconds or less. And I didn't say this with the P wave, but that's 3 tiny boxes or less, okay? Did y'all notice the normal duration for P wave and QRS are the same, right? Okay. What are we measuring here in the QRS? We are measuring the depolarization of the ventricles. And let's make note that the repolarization of the atria is happening at the same time. We don't see it though, because that depolarization of the ventricles is dominating at the time. Okay, let's label it. So back to 49. You're going to go back and forth to 50 and 51 and 49. Okay? All right, so we got our P. Let's label QRS now. QRS. And the QRS is measuring what?
The depolarization.
Depolarization of the ventricles. Y'all are so smart. Okay. May we keep rolling? What do you think we're going to talk about next?
T-wave.
T-wave, let's do it. All right, the T-wave shape, positive and smooth. So we want it positively deflected, a nice little smooth round bump there. And we are measuring the repolarization of the ventricles. Or we're able to measure the repolarization of the ventricles. I'm going to give you a couple extra things with the T-wave here. Okay, you ready? No, we're gonna label it first. I forget. Okay, let's label it real quick. So P, Q, R, S, and then you've got your T wave there. Okay. Let's look at this right here. So here's a normal QRST situation. Now take a look at the right side of this screen. What do you see? What do you notice?
The T-wave is negatively deflected.
The T wave is negatively deflected there, okay? We're gonna call that an inverted T wave. That's an inverted T wave there, okay? And I want you to write down, an inverted T wave can appear during an MI. What does MI mean?
Myocardial infarction.
Myocardial infarction. An ischemic event, and we'll define ischemic here in a second, or after a cardiac injury. Okay, so if I have a patient presenting with this inverted T wave, it could be signaling to me as the technician that this patient is having a myocardial infarction, an ischemic event, or has had a previous myocardial infarction or injury of the heart that they've recovered from, okay? Let's define ischemia. Have y'all heard of that word before? Not really? Okay, let's write it down. Ischemia means deprivation of oxygen. So I want you to write that down. So an ischemic event means the heart was deprived of oxygen for a period of time, okay? You can have ischemia anywhere in the human body, but obviously we're referring to the heart here, okay? Okay, so inverted T wave, let's say it out loud, could mean what?
MI.
MI,
Ischemic
an
event.
ischemic event,
Cardiac.
or previous cardiac injury. Very good. Okay. Okay, yay, U wave. Ooh. All right, there is a big X on this slide because it's so rare that you were going to see a U wave. We may have had a question about it, like a question about it on a certification exam, so that's why we like to talk about it. It is going to come after the T wave, and it's thought to be the repolarization of the Purkinje fibers to some. It's a debatable topic, okay?
Thought to be.
U waves are thought to represent the repolarization of Purkinje fibers. However, the exact source of the U wave remains unclear, okay? You've heard about it. You don't have to lock in a ton of information on it. Just, we've talked about it. You're gonna label it on page 49. But again, we barely want to talk about it because it is such a rare occurrence, okay? And I don't think we ask you any questions about it on our tests, all right? Okay, so let's label it. We got our P, Q, R, S, T, and there's your maybe U wave, okay? Okay, how we feeling? Any questions so far? All right. I think we're ready to move into our segments and intervals. So what I want you to do first is define it. On page 50, in the middle of the page, let's define what a segment is in an EKG. It's a region between two waves, okay? The wave is not included in the segment. And we'll look at a couple of them. If you look at our image here on the slide, this bottom one is pointing out the PR segment. And we'll take a closer look at it in just a second. I want you to turn the page to 51. And at the top of 51, let's define what an interval is, and then we'll come back and talk about our segments. So what's an interval? It includes a segment and one or more waves. So with an interval, the wave is included. Okay, so let's talk about a couple, go back to page 50, and let's talk about a couple of segments, and then we'll come back to intervals. All right, the first segment we're gonna talk about is the PR segment. This is, what is it? It's the end of the P wave until the onset of the QRS, okay? So your PR segment is at the end of the P wave until the start of the QRS. And this segment is showing us the slowing down of the conduction through the AV node. Remember us talking about the gatekeeper, how it holds the impulse that comes from the SA node for just a brief moment? That's what we're seeing in that PR segment, okay? Let's label it. Make sure everybody gets to write what they want. May I go to the next slide? Okay, here we go. It's gonna be this guy right here. So PR segment. Okay? This was our P, this was our PRS, and now we've just defined and labeled our PR segment. Okay. Let's talk about a new segment, and this one's really important, all right? We're gonna talk about the ST segment. So what is it? It's at the end of the QRS until the onset of the T wave. Okay, so it's that line that is after the QRS until the onset of the T wave. So what are we measuring here? We're measuring the time between ventricular depolarization and repolarization. This one is commonly used to indicate or help us assess if a patient is having a myocardial infarction or any type of ischemia, okay? Let's talk about this kind of left side of the slide here, and I want you to write this in your notes section. If we see something along these lines, you're getting lots of examples here. This is ST elevation, okay? And what it's telling me is that my patient is having a myocardial infarction, okay? So we call this a STEMI. It's a STEMI. What do you think it stands for? ST, elevated
Myocardial infarction.
myocardial infarction. Okay. Sloppy handwriting, but I wanted to spell it out, and I want you to spell it out, because this is something you need to really remember. All right? Sometimes this is referred to as, that was tombstone.
Oh.
Why do you think we call it the tombstone? Not necessarily, but maybe we're headed there if we don't take action. Can y'all see? I think this one looks the most like why we would call it.
Oh.
It kind of looks like a tombstone. So if that kind of helps you lock it in.
I don't know if I want to think about that, but okay.
So here's something to think about though. If I see ST elevation in one of my leads, what do I need to do as a technician?
Oh,
Remember how we talked about if we see something abnormal in one lead, what should we do?
Check the other.
Check the other leads that are, what's that word? I want you to remember, it starts with a C.
Contiguous.
Contiguous. I need to take a look at my contiguous leads. So I'm gonna look in those leads that are looking at the same area of the heart there. And if I see abnormality in 2 or more, then we're looking at a concern, right? Okay. If I wanna say anything else here. Okay, let's talk about ST depression here, all right? So if this ST segment goes below the isoelectric line, I'm gonna call it ST depression, and it is gonna be indicating ischemia. What did we say ischemia was? Deprivation of oxygen. Write it again, deprivation of O2, okay? So STEMI, myocardial infarction. ST depression, ischemia, okay? Something else to point out and note is your J point. So one way to help us kind of decide, is this ST segment elevated or depressed, is this J point. So it's literally this point right here where that T returns to the isoelectric line, okay? And we'll label it here on page 49 in just a second. But if this J point is 3 or more small or tiny boxes off of the isoelectric line, then I can call it either a STEMI if it's positively deflected or ST depression if it's negatively deflected. Y'all with me? Okay, let's label it. Okay, oh my. So we did PR segment here. Now let's label our ST segment here. Okay, and what else did I tell you about on that last slide? The J point. You do have like 2 little points here. We're just gonna label the J point. All right. Let's get into our intervals. Ready? Okay, so flip the page. We're on 51 now. Page 51. We're going to talk about the PR interval. So what is it? It's the onset of the P wave. So before the P wave starts until the onset of the Q wave. So my PR interval before the P wave until the start of the QRS. A normal duration for the PR interval, 0.12 to 0.20 seconds, or 3 to 5 tiny boxes would be normal in duration. What are we measuring when we look at the PR interval? So it's the amount of time for conduction to travel from the SA node through the AV node. So the amount of time from the start of atrial depolarization until ventricular depolarization. And what we're able to see is the AV node health here in this PR interval. Ready to label? Let's go back to 49. No, not yet. You can see that PR interval highlighted here in red. Let's go 49 and let's label it. Interval is different from a segment.
Interval includes the waves.
The interval includes the wave. Excellent. Okay, can we keep rolling? Let's do it. All right, this next slide has 3 different intervals. Let me talk about them and then we'll come back and label them. All right. The QT interval, really we're looking at the health of the ventricles here. So it's from, what is it? It's from the start of the QRS until the end of the T wave. So QT is from the onset of the QRS to the end of the T wave. We're measuring the amount of time it takes for the ventricles to depolarize and repolarize. Next, I got my P to P interval. This is a full cardiac cycle. So we're looking at it from the start of one P wave until the start of the next P wave. Okay, so it includes a full cardiac cycle measuring from one atrial depolarization until the next. All right, and this last interval that we're going to talk about is the R to R interval, and we'll need to use this tomorrow when we're learning about how, if a rhythm is regular or irregular, and how to calculate heart rate. So we use this one a lot, this R to R interval, and it's from the top of the QRS complex until the top of the next QRS complex, okay? So we're measuring from ventricular depolarization until the next ventricular depolarization. It's also a full cardiac cycle, but measuring from ventricle to ventricle, okay? And let me just say it again for repetition. The R to R is used in discovering if a rhythm is regular or irregular. I'm going to teach you more about that tomorrow. And we also use this R to R interval to help us determine a patient's heart rate, okay? I'm going to teach you some cool methods tomorrow. There are times where you might be looking at the P to P interval separate from the R to R interval, and they might not be the same. okay? And we'll talk more about that tomorrow. So you need to know that they're both a thing and how you would look at those intervals. Okay, let's label them. We good? Let's start with this PR interval. I'll have this one labeled. We talked about the QT interval here. So you got your QT interval there at the bottom. This would be my P to P interval. Okay, and this one is my R to R interval. Okay. Which one am I mostly using if I'm looking at regularity of a rhythm? R to R. I'm gonna need that tomorrow. Okay. Excellent. This next slide I think is just an overview. We did not talk about this TP interval, so don't worry about that. We did label our J point, and it doesn't have a P to P interval labeled here. Y'all can kind of see the overview. Any questions about what we just covered? Okay, let me check your understanding. So I want you to grab a whiteboard and a dry erase marker, and let's see where we're at. Did y'all have markers that work? Anyone? Sorry. Let's see if this works. Sorry.
Green. You can do it really
My
well.
boys were doing that recently.
Who?
My boys.
Oh yeah. I used to do that a lot when I was younger.
They were doing it with their cousins. Okay.
I did
Are
it
we
with
ready? Here we go. First question. The normal duration of a PR interval is. The normal duration of a PR interval is. I'm seeing a lot of right answers. Makes me happy. Very good. A. 0.12 to 0.20 seconds is a normal duration for a PR interval. All right, next question. True or false? This QRS complex has a normal duration. So think about what I told you was a normal duration for a QRS, and then take a look here. Yeah. Y'all can do it. True or false? Is this a normal duration? This is what my last class did. Everybody was saying false, but this is actually true, y'all.
It's 3,
Okay,
right?
why? Here's a little trick. Look at the tiny boxes, right? We said less than 3 tiny boxes, right? So if you're measuring, we start at the first deflection and finish at as soon as it returns to the isoelectric line. That's about 2 small boxes, right? And we said the normal duration for QRS was what?
Less than 3.
Less than 3 small boxes or 0.12 seconds. Okay?
Oh.
Okay. All right, let's keep going. Portion of the EKG strip frequently used to determine if a patient is having an MI or a myocardial infarction. A, B, C, or D? Correct answer is B, as in boy, all right? So the ST segment, remember, what do I call it? Yeah, a STEMI. Remember, if it's that ST elevated tombstone look, and it can look funky. It can look different. You're gonna get some practice at looking at different versions. All right, here we go. What is concerning about this EKG rhythm? Give me the most information you can give me. What am I looking at? What does it mean? Give me one or both.
I'm kidding.
I mean, you're not wrong, but we're not completely, no, not quite. I'm glad we're going over this one. You guys aren't wrong, but there is a correct answer here. This is inverted. Inverted T wave.
That's what I said.
Remember that? You said you.
Oh, okay.
You were the only one that fully said inverted T wave.
Okay.
Some of y'all were just saying it in other words, but you need to lock in inverted T wave.
And
Got it?
That's the not
And
bad.
it's indicative of, remember we talked about this.
Ischemic event, MI, or after
Ischemic.
cardiac injury.
Ischemic event, MI, oops, sorry, or cardiac injury.
Previously.
Yes. Sloppy, but y'all got it? Remember? So what is this
How you
called?
gonna,
Say it out
what you
loud.
do?
Inverted
Inverted T wave.
T wave. Okay.
She's a perfection.
All right, I think we got one more to look at.
Oh, wait.
What is concerning about this EKG rhythm?
Oh.
Oh.
Ooh, write it out.
Wait, it's the. Wait.
What are we looking at and what does it mean? What are we looking at? What's it called?
I got it. I got it.
Okay, I like that y'all are remembering the little catchphrase that I gave you.
Wow.
But what's it actually called? Did you write it? Yes. Yes. Okay, the word I want to see on your board is, and it's technically an abbreviation, but STEMI, and it stands for
ST
elevation.
elevated
Elevation.
myocardial infarction. All right, and some of y'all wrote tombstone. You're right.
J point ain't looking
We're
too good.
looking at some tombstones
Let's
here.
go.
Buddy is dead. J point not looking good. That's right. Okay, very good. That was it for waves, segments, intervals. How we feeling?
I was having fun.
I think you guys are getting it. We continue to build on that. You've got some practice pages to actually practice looking at different versions of what we talked about and measuring some of these things. But we need to talk about artifact today. My first class was like so not wanting to listen to me lecture, so I let them do this independently through Canvas. My second class voted to just listen to me punch through it real quick and get notes, and I actually preferred that.
Oh, okay.
Can I do that with y'all?
Yeah.
Let's just get through it, and then I'll give you the rest of class to practice, ask me questions, okay? All right, so we're powering through, and we're turning to page 60, okay? Anybody want to stand up or grab a donut or stretch or whatever? Give your little brain a hug. Are we still going?
Yeah, we're still going.
Is this in the side view?
It's the main food right now. Here, wait.
Okay,
We'll have a tour of the classroom.
have you guys heard me use the word artifacts this year yet? No?
Wave.
Is it still
Do it,
going?
Brianna,
Yeah.
go.
Do the wow.
Go.
Is it a time lapse?
Do the wow.
No, she wants to actually video this.
This is for.
This is the
my
break.
students
This is
who are on
the
today.
this is
Okay.
the video's break though.
If I haven't said the word
Intermission.
artifact, it's what we're looking at when you guys come to me and you're like, what is this on your EKG printout, right? Let's talk about exactly what it is, what causes it, and how do we fix it. Ready? There's 4 different types. So we're page 60. You're gonna wanna turn your page sideways a little, all right, to take notes.
Alright, we're locking back in now.
First of all, let's define what artifact is, all right? Another word for artifact, interference. It is electrical or magnetic interference that alters the EKG tracings. Are we still getting a good view here?
Yeah, we are.
Okay.
No, trust.
Trust.
Okay.
Yes.
You're saying, yeah, you trust us, but you're still fixing it.
Is that where you said the
We're locked in.
Okay, patient, guys, sometimes it's the patient
Just
who
scoop.
caused artifact. Sometimes it's the machine or something else outside of the patient that can lead to artifact. All right, patient causes would be seizure, trembling, fast breathing, dry or wet skin, or shivering, okay? Equipment causes, the gel in the electrodes has dried out. That's why they're in those little foil packs when you guys grab them in there. Damaged lead cables, electromagnetic frequency or interference from cell phones or other electronic devices or outlets.
We have to write all of those.
Okay? I mean, it's a lot. We're actually gonna break it down a little more, so if you don't get all of it, it's okay. Let's keep going. All right, let's talk about the first type of artifact. Wandering baseline. Wandering baseline, you're looking at it right here. So that's when that isoelectric line is kind of moving weird and not just straight across the tracing or the page there. What causes it? Poor contact between the electrodes and the patient's skin. We've kind of talked about different things that might cause that poor contact. So what do I want you guys to do when you're placing electrodes? Use an alcohol swab to clean that area where you're gonna place the electrode, right? But sweaty skin, hair, lotion, lead wires not properly clipped to the stickers could also be part of the issue. All right, if the patient is moving, movement of the cables or electrodes during the reading, tension on the lead wires. Y'all know how those wires get totally tangled up sometimes, and if you're trying to stretch one to a certain area, that could be causing this. Labored breathing, loose or dry electrodes. That's a lot of causes there for your wondering baseline, but you do need to know them. And we need to know how to fix them. So that's the next slide when we're ready. Are we ready? How do we correct the problem? We are going to properly prepare the skin, which we just talked about. Maybe use the alcohol swab. If you need to shave the patient's hair. Check the lead wires are properly clipped to the electrode stickers and that wires are not pulled too tight. We should never tell a patient to hold their breath. Okay, you will get questions about this. Never tell your patient to hold your breath. It could change their heart rate. And encourage our patient to be as still as possible. So we don't want them moving, talking, laughing, crying. They need to be as still as possible. Okay? All right.
Stop crying.
That's how we're going to correct wandering baseline. Okay,
Caden's always talking.
next one. What are we talking about next?
Am I supposed to do an EKG on you? You're always talking.
Okay, next one down, ready?
Yes.
Is somatic or muscle tremor. All right, so what's causing this somatic interference or artifact? The patient could be shivering, tremoring, maybe a seizure, maybe talking, laughing, coughing. So it says here on the slide, the heart is not the only thing in the body that produces measurable electricity. When your skeletal muscles undergo tremors or movements, that EKG is bombarded with seemingly random activity. So it looks very chaotic, all right? It can be caused by voluntary or involuntary muscle movement, okay? So somatic is from muscle movement of the patient.
Stop coughing.
You're gonna talk that way to your patient?
Well, isn't that one of the solutions?
Okay, so how do we fix it? Here's some ways that we can maybe help with somatic artifact. Ask our patient to lie still and not to talk. Not Luke's method. Don't yell at him. Gently encourage. All right, give your patient a blanket. Y'all seen the warm blankets in the hospital, have y'all? You can go get them a warm blanket to kind of help if they're cold. Keep the room at a warm temperature if possible. Here's one that I know we've gotten questions about. If your patient has Parkinson's or a really bad kind of uncontrollable tremor, have them put their hands face down or palm down under their buttocks. Okay? If they are shaking or tremoring for any reason. We can move limb leads to the torso. We already know about that. If they are actively seizing, wait until seizure has stopped unless otherwise directed by provider.
Let me just.
So if you just stay still, like please stop.
Can you just like stop?
Okay. Questions so far? You got it on somatic? Okay, let's go AC. So this is AC interference. Please also write down 60 cycle interference. They mean the same thing, okay? And you might see it worded either way, AC interference or 60 cycle interference. AC stands for alternating current. It describes the type of electricity that we're getting from the wall, okay? The cause is poorly grounded EKG machine or not equipped to filter out this type of current. Have you guys noticed this kind of, I've already seen it on some of y'all's printouts. It's probably because of our machines and or the electrical outlets that we're using. That's the worst. Further from us or closer to us?
The one that's closer to all of the posters with the,
So this one, yeah.
Okay.
this one.
Okay, yeah. Electronic devices such as cell phones, IV pumps, insulin pumps, etc. All kinds of machines in the hospital, right? Those things could also be contributing to this type of artifact. This little fuzzy caterpillar is just kind of a visual to help you remember. If you see that kind of fuzzy little caterpillar look,
It's terrifying.
we are,
Those caterpillars will kill you.
right? This one in particular, not all fuzzy caterpillars.
A lot of
Like
them.
asps.
I never knew what an asp was until I moved to Houston.
They're terrifying.
We didn't have them in Oklahoma.
You can die by a
Asp
tiny
is
little.
like a furry caterpillar type
My mom
thing.
got like
And it's
one
super
fell.
poisonous.
If you touch it, it releases like little micro neurotoxins and can like,
In elementary school, they
well, it can hurt you. I think it can like really hurt other organisms. Like I let my dog touch one time, y'all. This was years ago.
And they died.
And she was the sickest she's ever been, like
Ooh.
ever. I had to take her to the emergency vet. She was like drooling. It was so bad. Anyway, wow, we totally derailed.
They're scary.
So let's keep going. So how can we fix this? What are ways to troubleshoot? How do we correct it? We can plug the EKG machine into a different outlet if that's an option. We ask our patient or physically help to remove any electronic devices that could be creating this artifact. Maybe we even move the bed away from the wall because that's where all the electronic things are or plugged in. Check any other electronic devices close to the patient and move or unplug if possible. Obviously, you're never gonna unplug anything without knowing what it is and having permission from a provider, right? So never unplug any necessary medical equipment. Okay. Let's go last one. Last one is interrupted baseline. So this is artifact that looks like a break in the isoelectric line. It's caused by broken or disconnected lead wires. How do we correct it? Perform regular maintenance on your EKG machines and check to make sure that all lead wires are connected to the electrode stickers. Okay? So I want you to, some of our machines will print out a 12 lead EKG and the isoelectric line is in a different place from lead 1 to AVR. And so it looks like interrupted baseline, but really you're looking at two different views, if that makes sense. You guys following me?
Mhm.
That's not interrupted baseline. If we were looking at a continuous feeding of, let's say, lead 2, and I had this happen in the middle of that tracing, that's interrupted baseline, okay? All right, let me ask you a couple questions. Y'all still got your whiteboards handy?
Uh-huh.
Here's a little practice. Here we go. While performing an EKG, you notice the artifact shown below. You assume the problem is likely, is it A, B, or C? Okay, I'm liking what I'm seeing. I'll give everybody a chance to reflect.
Deadly caterpillar.
Yes, the fuzzy caterpillar look, right? So I would go with answer C here. That's gonna be our electronic device causing interference. While performing an EKG on a patient, you notice the following artifacts. The most appropriate action would be, what are we gonna do? So what type of artifact is this and how do I fix it? Okay?
C.
I like what I'm seeing. Very good. Yes. B is your correct answer here. What type of artifact are we looking at?
Somatic.
Somatic.
Or-
This is somatic or I
Tremor.
didn't hear, let's see what you said. Very chaotic. All right, so this is muscle movement from the patient. An option would be placing a blanket, okay, to help calm them or still them. How might we correct the artifact seen below? So we got to identify what is this artifact and how do I fix it? It is, oh, actually, this is wandering baseline here. And the correct answer is C. We could do either one here to potentially correct, okay? So see, it never like breaks, we're just wandering. Okay, I think that was it. Great job, guys, we did it. Got through segments,
Yay.
intervals, waves, all the artifact. Let me give you guys a little brain break, and I want you to work on pages 52 through 55, okay?
Wait, go again.
Wait, do that again. Oh no!
You stop it.
That's me, Luke, and Brianna.
Oh, you little
Literally.
cuties. Oh,